Hello, and thank you for joining Oakland Community Health Network for this health training about chronic pain and understanding medical documentation. I'm the presenter. I'm Susan Stevens. I'm a registered nurse, and I'm also a nurse case manager at Oakland Community Health Network. The purpose of this training is to help individual organizations determine the level of training needed for their staff depending on their position and job responsibilities, upward movement in terms of skill competency for staff, and to be able to coordinate primary care needs for people who are living with intellectual or developmental disabilities or persons who are severely mentally ill. The learning objectives are to learn about chronic pain and how it affects the body and how medical documentation works, and to discuss chronic pain types, treatment, and management, and to discuss medical documentation, HIPAA, and common labs, and to review a couple goals related to common pain, and to review resources that we have available. Chronic pain. Did you know 50 million Americans, or 20% of the population, live with chronic pain? And chronic pain is the leading cause of long-term disability in the United States. And pain is the #1 reason Americans access the healthcare system. Vital signs are a group of important medical signs that indicate the status of the body's life-sustaining functions, and these include the body temperature, pulse, respiratory rate, and blood pressure. Now, pain is the 5th vital sign. The evaluation of pain has become a requirement of proper patient care, and pain can't be measured objectively. Pain is influenced by expectations, significance, cultural beliefs, emotions, and the context in which it is experienced. What is chronic pain? This is a condition characterized by pain lasting at least 6 months or longer, and it can affect any part of the body and cause various sensations of pain. The pain may not be constant, but it disrupts daily life. And chronic pain can limit mobility and reduce flexibility, strength, and endurance. Acute versus chronic pain. Now, acute pain is suddenly triggered in the nervous system to alert you to possible injury, and it can be mild and last a moment or severe and last for weeks or months. Acute pain is temporary. Chronic pain signals a firing in the nervous system for months, even years, and pain signals are sent to the brain even after the injury heals. Chronic pain persists. Now here's a video about acute versus chronic pain.
Kia ora, talofa and welcome. I'm Dr. Janine Bycroft from the Health Navigator team, and in this short video I'm going to explain the difference between acute and chronic pain. Pain is something we've all experienced at different times, and while no one likes being in pain, it's actually an important protective mechanism to keep us safe and reduce further pain or injury. Pain can be acute, short-lived, or chronic and ongoing. It's important to know which type you have because the treatment options are quite different. Acute pain is your body's way of warning you that something is wrong. It often comes on rapidly, lasts for a short time, and then goes away. It's usually caused by something specific, such as an injury, infection, surgery, or an illness. This contrasts with chronic pain, where the cause is often unknown or more complex. Pain can be described in many different ways for both acute and chronic pain, from sharp or stabbing to a tightness or burning sensation, an aching or throbbing. Chronic pain is pain that persists and you experience most days for 3 months or more. It can range from mild to severe, be constant, or come and go. Living with chronic pain can be hard work, but many people with chronic pain do get better, and most can lead normal lives. It is often described as pain that does not go away as expected after an injury or illness. Chronic pain is thought to occur when nerves become oversensitive and keep sending warning messages to the brain, even when there's no injury or after the original injury causing the pain has healed. The brain thinks there is harm and reacts by feeling pain. In other words, the fire has been put out, but the fire alarm is still going off. Treatment for acute pain will depend on a number of factors, such as what is causing your pain, where it is located, how severe it is, and your personal preferences. Treatment options typically include pain relief medicines such as paracetamol for mild to moderate pain, non-steroidal anti-inflammatories such as ibuprofen, naproxen, or diclofenac, which can help reduce inflammation and swelling. For acute injuries such as a sprain, you'll find the RICE approach useful. R is for rest, I is for ice, C is for compression, and E is for elevation. Bandages such as a crepe bandage or tubie grip can be used to provide compression and support. A sling or pillow can be used for elevation. For chronic pain, treatment is more complex. Chronic pain is often described as a cycle, where persistent pain often leads to one doing less, which leads to loss of fitness, tiredness, and less energy. This often leads to poor sleep, feelings of frustration, anxiety, low mood, stress, or anger, which results in more increased pain. The increased pain then causes you to have more low mood, tiredness, and stress, so you get caught in an endless cycle. The good news is there are several ways you can approach managing and treating chronic pain to start feeling better. Treatment of chronic pain needs a broad approach and takes into account your mental, physical, and emotional needs, and identifying each of the areas you can do something about. If you think you have ongoing or chronic pain, see your doctor or healthcare team to help work through what approach will be best for you. You can also see the next video in this series on tips for managing chronic pain. Thanks for watching. For other videos in this series and pain resources, do visit the Health Navigator website at www.hn.org.nz.
Some of the contributors to chronic pain include previous injury, surgery, being overweight or obese, age for the natural aging of the spine, and disease including arthritis, diabetes, fibromyalgia, being female for chronic musculoskeletal pain. It's really more common for females to have a lot of these conditions. Some common types of chronic pain: neurological pain, which results from nerve damage, psychogenic pain resulting from an unknown cause, headaches, post-surgical pain, lower back pain, and cancer pain. Some myths about chronic pain include: if people look healthy, they cannot be in pain. If a doctor cannot find the exact cause of the pain, then it must be in the person's head. Another is to consider themselves worthwhile. People must be able to function in the same way they did before their pain. And chronic pain treatment will be effective within a short period of time. These are all myths. Some physical effects of pain: poor wound healing and muscle breakdown, an increased heart rate and blood pressure, having insomnia, feeling fatigued, shallow breathing, and decreased gastrointestinal mobility. Psychological effects of pain include loss of enjoyment of life, depression, increased risk of suicide, difficulty relating to others, anger, resentment, anxiety, fear, and stress. Some treatments for chronic pain include medications such as opioids, which will be like morphine, codeine, hydrocodone, and non-opioids such as acetaminophen or Tylenol, and ibuprofen, and that would be like Advil. Some muscle relaxants, topical pain medications, and some procedures like electrical stimulation. An electrical current is applied to the muscle to reduce pain. There's therapy, which includes acupuncture, Tai Chi, which can both reduce pain and stiffness. Self-care and nutrition would include staying active, getting massage, eating whole and healthy foods that can help people feel better. Addiction. This is a compulsive, chronic, psychological or psychological need for a habit-forming substance, behavior, or activity having harmful physical, psychological, or social effects. Typically causes well-defined symptoms such as anxiety, irritability, tremors, or nausea, and upon withdrawal or abstinence. So it typically can lead to all that, the withdrawal or abstinence. Now, opioids are used to treat chronic pain, and they can have physiological effects from the first use. Overdose. Drug overdoses can be accidental or intentional. They're characterized by a loss of consciousness, reduction in breathing, vomiting, limp body, change in skin color. And did you know a drug overdose is a leading cause of injury, death in the United States? Now, if you or someone close to you needs help for substance use disorder, call your doctor or call SAMHSA's National Helpline at 1-800-662-HELP. Living and coping with chronic pain. Things to do would include join a support group, try to exercise, keep a pain journal, continue to eat healthy, eat as healthy as you can, and learn relaxation techniques or things that might help distract you. Here's some SMART goals for chronic pain. I will attend all my physical therapy appointments in the next 3 months and follow recommendations for exercises at home. Second goal idea would be in the next 2 months, I will schedule a reoccurring appointment, which would be like every 2 weeks, with my therapist to manage my anxiety and depression caused by my chronic pain. Understanding medical documentation. What is a medical record? A medical record's notes or written entries used to keep track of someone's medical history. This includes diagnoses, medications taken, therapies, and the terms electronic medical record is an electronic health record, also known as an EHR, and a medical chart are all used interchangeably. So most of medical people use electronic medical record, and then those of us in the social work and working in the behavioral health field, we tend to say more electronic health record. Most medical records are now electronic and can be easily shared with other healthcare professionals, and a person has a right to access their own medical records. Now let's watch a video about why medical records are important.
Every time a new patient is admitted to hospital, a new medical record is created. The medical record documents relevant information about the patient during their stay. It forms the legal record of care provided and is essential for clinical communication. When the patient is discharged, the medical record is sent to the hospital coders, who take the information and convert it into code. These codes are then used to identify trends and patterns of disease, improve the safety and quality of care, and to determine the cost of providing that care, so that the health services receive the appropriate funding. An incomplete or ambiguous medical record can lead to inaccurate coding. Due to strict coding rules, coders cannot make assumptions about diagnoses, procedures, medications, and complications. If the medical record is unclear, hospitals and their patients can miss out on the funding they're entitled to. If it isn't clearly written down, it didn't happen. To avoid this, clinicians should ensure that clinical notes are complete, legible, and updated in a timely manner, are as specific as possible, and use only commonly accepted abbreviations and terminology. Clearly document the principal diagnosis as well as any additional diagnoses, and identify all diagnostic and therapeutic interventions. Clinical notes should provide clear links between symptoms, medications, and treatments provided. In the case of complications, clearly documenting when the condition began, whether a complication was present on admission, or arose during the episode of care. This will ensure that not only the next clinician, but coders, researchers and planners can take this information and use it to its full potential. Because a healthy medical record, clear, complete and coded, will not only improve outcomes for every Australian patient, but our healthcare system as well. The clearer the record, the brighter our future.
HIPAA. HIPAA is the Health Insurance Portability and Accountability Act. It protects your health information. Only you and your healthcare providers and people you choose as a personal representative can view your health records. You have the right to request a copy of the medical records at no cost. A personal representative can act for the individual and exercise the individual's right. The parents of a minor would make medical decisions on the minor's behalf unless otherwise legally specified. A person may be appointed legal power of attorney for an adult or emancipated minor, excuse me, and have the power to make medical decisions for the adult or emancipated minor. What goes in a medical record? Notes from all doctor's visits, which would be by the doctor, the nurse, or therapist. Personal information, including age, address, insurance information, emergency contact information, vital signs taken upon arrival, which include the blood pressure, temperature, and the heart rate. Medication information, the type, the dose, the frequency, diagnoses, such as hypertension, depression, diabetes, medical procedure notes, laboratory tests and results, someone's plan of service, care plan, immunization records, allergy and medical history. Here's an example of an electronic health record. It's kind of a busy slide, but this was kind of showing how it might show to a person looking at the record. Has patient information, has their summary of diagnoses, medications, and the visit history. Some common tests ordered by a doctor would include cellular and chemical analysis tests, which these are for diabetes, it's an HbA1c, and that's a test that they get like a 3-month average of someone's blood sugar, how it's running, how they're managing on their own for the last few months. They might have a different type of blood analysis they need to do, such as a CBC, which is a complete blood count. A kidney function test might be ordered, a pap smear for a cervical cancer test, sexually transmitted disease testing, therapeutic drug monitoring. Genetic testing, this could be a complementation test to look for gene mutations. Diagnostic imaging, such as an ultrasound, brain scanning, or lung ventilation or perfusion scan. Physical and visual exam tests include skin tests to determine allergies, auscultation tests where doctors listen to the sounds within your body with a stethoscope, and measurement tests such as pulmonary function to test and analyze the lungs, an EKG, which is an electrocardiography to assess the heart, and also electromyography, which is a graph for electrical characteristics of muscles. Some barriers to care would be a physical environment that is not accessible, having a lack of relevant assistance technology, such as having assisted devices, adaptive devices, or rehabilitative devices, such as even like a cane or a wheelchair, things like that. Having a negative attitude towards people living with physical disabilities or substance use disorders, and services or systems and policies that are either non-existent or that hinder the involvement of all people with the health condition in all areas of life. How can we help? We want to work to reduce the stigma around disabilities, mental health, and substance use disorders, and help coordinate care for people we serve, connect them to resources, and advocate for policy changes. As a reminder, it's really important to have a person regularly see their primary care physician regarding their mental health, medication management, and physical ailments to promote health integration. Here's a list of some national resources. There's a National Drug Helpline, and SAMHSA's here, Addiction Help, U.S. Pain Foundation. Here's some local resources. And My Strength is like a personal tool anyone could use. It's web-based, so it could be an app for your phone. It can also be on the computer. And it has lots of like PowerPoint walkthroughs on different conditions and the resources and things people can do to help give themselves coping skills and education about their conditions. As a reminder, don't forget to take the quiz linked in the video description area to test your knowledge on this health training. And if you have any questions or you want to contact me, here's my email address and phone number. Thank you for joining.